Welcome back. It's 5:14 in today's Health Watch. Millions of Americans who take prescription medicine also use supplements like vitamins, herbs, or botanicals. Because these products are natural, it's easy to assume they're harmless. However, healthcare professionals warn combining supplements with prescription medications can cause some dangerous side effects. Fox Medical Team's Beth Galvin joins us now to talk about this. Good morning, Beth. Many doctors recommend us to take vitamin D, things like B12. So what are the supplements we should worry about in interacting with prescriptions?
Well, good morning, Pam. So I think it really depends on, the medications that you're taking, the prescription medications or over-the-counter medications that you're taking and what you're taking them for. And so it's really important to have that conversation with your doctor if you're going to try something new. But so, for example, if you're on a prescription blood thinner to lower your risk of stroke or, other complications like that, or you're taking aspirin, which is also an over-the-counter blood thinner, you want to avoid supplements like very common supplements like garlic, ginkgo, ginseng, vitamin E, even glucosamine, because all of those can have blood thinning effects, and that can raise your risk if you're combining two things at once doing the same thing of having internal bleeding or even having a bleeding type stroke. Another thing is, if you're on an antidepressant, you want to avoid St. John's wort, which some people take sort of as a natural antidepressant, because combining a prescription antidepressant with St. John's wort can cause serotonin levels to increase very quickly to dangerous levels for you. And then the same thing with St. John's wort may affect how other medications react and how effective they are. So if you're taking St. John's wort, it can make taking birth control pills less effective. It can make organ transplant medications, heart medications, HIV/AIDS medications less effective. So it's just really sort of about knowing what you're taking and what might cause a problem. And that's really a conversation, I think, with your healthcare provider. Same thing with someone who's taking metformin for diabetes. They don't want to then be taking Golden Seal, a supplement, because that can make the medication for diabetes less effective. So, Pam, it's sort of like, these combinations, I could probably list all day different combinations that can be problematic, but it's really about what you're taking, for what you're taking it, and mixing something new in there.
Wow, overwhelming. There's so many things that I hadn't even thought about, and common medications, like you're saying. So what is the best way to tackle this? Make sure that you list all supplements, like with your doctor, with your pharmacist. What should we do?
Yeah, I talked to a pharmacist about this, and he said, I really kind of want to know everything that you're taking. So put it all out there. So even if you don't think, a vitamin or a mineral really matters, it can matter when we talk about drug interactions, because those are drugs too, even though they're natural supplements. So in the vast majority of people, that's going to be safe and no problem. But if you're taking multiple medications, you want to make sure that adding something new into your repertoire, that you check with your healthcare provider first, make sure that that's, okay, you're not at risk of having any kind of an interaction, and you should be good to go. Pam?
If you have that conversation with your doctor, does that information get to the pharmacist, or should you also discuss with the pharmacist?
So I don't know that it will necessarily get to the pharmacist, because the pharmacist isn't filling it if you're buying it over the counter. And you do want to be careful about over the counter medications too. We're talking about supplements, but over the counter medications can also cause problems, because sometimes you'll have two different medications that have the same active ingredient, and you'll get kind of too high a dose of the active ingredient if you're looking at prescription and over the counter. For example, acetaminophen, which can be problematic if you get too much of that for your liver. So it's really, I think, about updating both the pharmacist and your doctor if you're starting to take something new. And really, if you don't want to go and take time to go see the doctor, talk to your pharmacist at your local drugstore. Ask them, hey, I'm thinking about taking A, B, or C. Is this a good idea if I'm already, if you see what I'm already taking?
Great advice, because I know you can make an appointment with the pharmacist. Beth Galvin with our Fox Medical Team. Thank you so much. Very important information. Thank you.